All right, hey guys, what's up? Welcome. My name is Stephen Dunn. I'm a physical therapist with Core Therapy and Pilates. I want to welcome all the Core family, our new physical therapist / occupational therapist, Mr. Andy. So Andy is going to be new to our studio. He's going to be working with us starting next month. Actually, I should say November because we're the last day of September still. So in November, Andy's going to be here working with us full time, moving here from New York City. So with that said, Andy, tell us a little bit about your background and what brings you to Austin.
Hello everyone. So I'm Andy and I'm originally from Taiwan, but I moved to Florida in 2014 for school, and then I graduated from the University of St. Augustine in Florida with both a PT and OT degree, and I've been practicing in New York City for about 2 years. And then during that time, I also got trained to become a Pilates teacher. So it will be a great niche that I will be coming here to join Steven, his team, to work with you guys, not only as a PT, OT, but I also bring a lot of things that are relevant to Pilates and then utilize a lot of the Pilates principles in helping my clients in general.
Awesome. And one of the big things that we get frequently asked about with our Pilates is where we're trained and how we're trained. So I want to just go through a little bit of that for a second. Cheryl and I were trained in Los Angeles when we lived out there into something that's called contemporary Pilates. And Andy was trained in New York City in a style of Pilates that's called classical or authentic Pilates. And they're both Pilates, but they're a little different. And I wanted to kind of go over that a little bit because it's a question people ask us all the time. And now I've never known how to truly answer the question for the authentic side because I've never done one of their programs, whereas Andy has. So I just want to go over that a little bit. As a contemporary therapist, the way we look at the Pilates repertoire is based on kind of the current model of research of what we know about biomechanics and what we know about certain conditions. And we've adapted the work that Joseph Pilates presented back in the early 1920s, the 1930s, 40s, 50s, and so on and so forth. And that's kind of what I know about the contemporary style because that's what we do. But now, Andy, my question is coming from a classical style in New York City, could you explain a little bit about what that philosophy is and what that looks like as a training?
Yeah, so I think the main difference is from the fundamental principles. The classical world focuses more on the principles of precision and flow. They want the actual choreography of the many joints, not just the proximal core engagement, but then also during the same time what you're doing, they have more specific focus during a lot of the techniques. And then also the flow, even the transitioning from technique to technique, how you are transitioning, it's a big focus in the classical world because the classical Pilates world also view that as part of the exercise that can help to build up the client stronger. And especially a lot of the people in the classical world are dancers and performers. They need that flow transitioning and how they move from one movement to the other movement. So that's a big focus. I feel like that's the most different part.
And so, hey Jeremy, what's going on, brother? Thanks for hopping on, man. Thank you. So yeah, it's really something, I love it because now we have two different styles of Pilates in one facility. And the way I teach and the way Andy teaches is going to be a little different, and that's okay. It's going to be just fine. And certain people are going to respond to the way I teach, and certain people are going to respond to the way he teaches, and certain bodies are going to need the way I teach, and certain bodies are going to need the way he teaches. And it's not a competition between him and I or anything like that. And I just wanted to talk about that because everyone wants to make it like a competitive thing and like, oh, this way or that way. Well, you know, we're open to having what's right for the patient and what's right for the client. So I just wanted to go over that a little bit. It's really not a big deal, but to some people in the Pilates world, It is. And so I just wanted to go over that, and people that are inquiring about our training and the style of Pilates that we teach. Well, we now, not only do we have a classical trainer, but we also have a classical trainer that is a physical therapist and actually an occupational therapist. Now, one more question and then we'll wrap this up. I've been a PT for 21 years, and I was in school with occupational therapists, and I've worked with two occupational therapists back in 99 to 2001, and I worked with them in like an inpatient setting. But I haven't worked with occupational therapists since 2001. Tell me a little bit, and tell our team, our core family, a little bit about what's the difference between, they know what physical therapy is. What's an occupational therapist?
So the main difference is the focus, I would say. OT is focused more on how to improve the functional performance of the person, like if they can perform certain activities throughout their daily life, that's very important to them. Whereas PTs are more focusing on the actual root cause that's causing some movement impairment, movement dysfunction. So it's OT focuses more on activity performance, and then PT is more on the solving the problem that's causing movement dysfunction. But then in this setting, everybody is focusing on helping you guys, helping all the clients to eventually do what you love to do. So that's essentially, I feel like that's the same, like from my OT background and then what Steven has already been doing as a PT, we are pretty much addressing the same.
I was just about to say that, because I am a PT by training, but I was kind of forced into this world slowly but surely of holism. And I say I wasn't forced, I chose it, but it found me. And as I got interested in it, as you answered that, it made me say, that's kind of how I approach the body already. So that's an interesting concept, that as a training, they learned something that I did not learn in my training at all. But I'm a PT that kind of thinks a little bit maybe more like an OT as a whole big picture than, even though I'm not an OT, but it's kind of cool. So, all right, I love that. I love that answer. So with that said, we're going to wrap it up, but I just wanted to introduce Andy. He will be here in a month in November, the beginning of November, moving to Austin, moving here from New York City. I don't even know if we said that.
Yeah.
Did you say that?
A little bit, like when I was talking about my training.
Okay, so that's right. So he's coming from New York City. Forgive me, I'm old. I'm not young buck anymore like Andy. So, but with that said, we're super happy to have him. We've been showing him around Austin all weekend, giving him some barbecue, eating some goodies, and showing him the little Texas hospitality. So with that said, what are your thoughts on Texas so far?
Everybody's so friendly, and definitely look forward to my move to Texas.
Awesome. Well, guys, thank y'all for your time, and we'll see y'all soon, and you'll be seeing Andy around the studio real soon. Bye now.